Hi there, I'm Dr. Jeff Grosskopf, and this video is intended for workers' comp attorneys. Now, I've been in the injury space now for over 16 years, and my specific focus is spinal injury. And working with attorneys over the years and speaking with them and meeting with them and talking about your cases, I've realized there are some things that are being missed with your clients and that there are some documentation that is lacking in a lot of your cases. And so I've put together a quick 5-minute presentation. And the intention here is to help you with your cases to get better documentation and to understand some of the injuries that are being missed. So, that's the first thing. I know without a doubt, when you have clients who have neck, low back injuries, I know there are specific injuries that in most cases are being missed and aren't being documented properly. So I want to show you what those injuries are. Also, I'm going to show you the guidelines for these injuries. Now, I know within the workers' comp world, you're not needing to follow the AMA guidelines, but the reality is when you have a doctor who does understand the guidelines, and the guidelines tell us what the injuries are, how to work them up. The guidelines also give us the impairment and disability ratings. Now, even though you're not working up your cases based off of these guidelines, a doctor who understands them and can document them just adds a nice layer of evidence to your case. It gets rid of opinion. I know the workers' comp world is dependent on a lot of opinion of the doctors, and that's okay. But the more you can get objective, specifically with these spinal injuries, you're going to get better results for your clients because it's going to be so much easier to show and prove the spinal injuries they have and the permanency of these injuries. And then lastly, I'm just going to discuss why you may have some clients that maybe they have a normal MRI, maybe a normal X-ray, or maybe those tests aren't looking too bad, yet your client is really suffering with debilitating pain. Something is being missed. So I'm going to show you those injuries that are being missed and then how we find them. Also, we're going to talk about your clients who maybe they have symptoms beyond their spine. So they've had a fall, they've had an injury to their spine, their low back, their neck, but now they're having some other issues, and these issues are lingering. Maybe they have dizziness, headaches, ringing in the ears, vertigo. There's other complications that can come from the spine. And again, you have to be able to find the right spinal injuries. And so this quick video, I'm just going to show you what those injuries are, how they're documented, what they mean for your client and for their case, and also the permanency of these injuries, because it's going to help you when you have to get the best benefits for your client. So just take a quick minute here. We're going to do a quick slideshow. I'll show you these injuries. If you need anything, please reach out to me. Okay, so we're going to take just a few quick minutes. I want to show you specifically the spinal injuries that are getting missed in most of your cases. And again, how do I know that? 16 plus years I've been in the injury world. I see the cases, I see the patients that are suffering when injuries are missed. And we're going to talk specifically about spinal injuries. Now, spinal injuries are easy to work up. They're just frequently missed. There's only 3 ways you can injure your spine. You can fracture your spine, which you can see on an X-ray or CT. You can have a disc injury. The disc injury is where most doctors and attorneys are going to spend a lot of their time. And then the last spinal injury is an injury to the ligaments of the spine. The ligaments are the outer, let's say, layer of the spine, and this is what is supporting the spine. Now, what's easy about the spine is your spine is only bones and ligaments. So the spinal cord is not your spine. The nerves are not your spine. The muscles are not your spine, meaning I could cut a nerve and not injure your spine. I could injure a muscle but not injure your spine. But the spine is just bone and ligament. It's bone and connective tissue. And you have the red support ligaments and you have the blue disc ligaments. And only about 10% of these ligaments are the disc. So right there you start understanding the focus on just 10% of the spine is why a lot of people's or a lot of your clients' injuries are being missed. But again, these red support ligaments, these are the tissue that is being missed in these cases. And when these are injured, these cause a permanent injury. So what would it do for your cases to find a permanent injury that we could document? Okay, so I'm going to show you just what you look for. With an MRI, you're looking at a couple things. You're looking for the disc, all right, the health of the disc. Is it bulging? Is it herniated? However, what do you do when you have a case where there's a mild bulge? Maybe there's even a herniation, yet the client isn't recovering, or you have a doctor who says, hey, their particular symptoms aren't related to this disc injury, or there isn't enough supporting evidence with the disc. How do you handle that? I want to show you specifically. And again, I want to show you the symptoms that come with a disc injury and a spinal ligament injury. Okay, two different parts of the spine. So a disc injury is going to cause your client pain, axial pain, which is pain right on the spine, and then radicular pain, pain that can move, go down the legs, down the arms. Now, the injuries to the support ligaments cause a lot more symptoms. So this can help you with your clients when they start telling you what they're still experiencing. Does that go well with the MRI, or is there something that's being missed? When your clients have ongoing symptoms like headaches, vertigo, nausea, ringing in the ear, trouble sleeping, or they just have that MRI that doesn't really look too bad, yet they're in severe back and neck pain, they're unable to move properly, they have trouble turning, bending, they have these ligament injuries. These are very easy for us to find once we know what to do. So with these injuries, we have to do x-rays, but the x-rays are done through a very specific procedure where we're having your client or my patient, we're having them move into different positions where we can see if there's too much movement through the bones, and we know that then there's a ligament injury. Now, the nice thing on my end about these injuries is they're 100% objective and they're a measurable injury. We do these according to the AMA guidelines. So the AMA guidelines tell us how we should do these x-rays, how to measure them, and then we're able to take those measurements and know if your clients want to have a permanent injury, what the impairments are, what the disability rating is. And again, I know that may not necessarily play in directly to the cases and the compensation, but for your clients. But with your cases, when you have these clients who have these injuries, when we're able to find these injuries that are missed, it gives a nice layer of objective data and objective imaging and documentation that can show that your client has a permanent injury. So if you have any questions on this, please reach out to me. All my information is with this video. We'd be happy to get on the phone, talk to you about any cases, any problems you're having, or even work this up for your clients and look for these injuries with them. I think we know the IME doctors, a lot of the therapy companies that your employee or your clients, their employers like to push them to certain doctors and certain therapies that maybe aren't in their best interest. So if you need a good objective doctor who can find spinal injuries that are being missed, this would be the place for you. Give us a call. We'd love to help you out with your cases. Take care.